In Texas, we had a particularly onerous situation. We had 1.5 million uninsured children. We had the greatest percentage of uninsured children in the nation. We also had a legislature that we had to go through, that it was a Republican House, a Republican Senate, and a Republican governor. So we had to find a different approach. And the question is, where can we find our allies? Who can we build coalitions with? And we're good at building coalitions. We decided to go into the business community. The point of entry was an automobile dealer in Houston, Texas by the name of George DeMontron. George is a great guy, very businessman, chairing the health committee of the Chamber of Commerce in Houston. We went to him and we said, George, your charge, as I understand it, is to reduce the increase in health care costs at corporations, the health insurance premiums. Do you understand that we have a public health care system where if a child has an asthma attack, they're hospitalized, it's $4,000. They're discharged without a nebulizer, which could prevent the next attack. That would only cost $40. You get that cost in your health insurance premiums because the hospital will pass it along to you, to the extent that 16% of your health insurance premiums reflect the uninsured. You would do well to help get these kids insured. He said, prove that for me. Okay. We went to the Federal Reserve, which has an office in Houston. We said, would you write a white paper on this because we know you understand that and it's an area of concern. And they said, we don't have time, but we would convene a meeting if you wanted to discuss it with the business community. Okay, hold that. Then we went to the mayor and we said, would you be willing to speak to the business community at the Federal Reserve about health insurance? And he said, absolutely. Pick a date, lock that date. Then we went to the lieutenant governor, who was a Republican but also happened to live in Houston. We said, would you be available to open comments at 7:30 in the morning to a conference of the business people at the Federal Reserve with the mayor speaking on the other end? He said, I can handle that audience. Okay, so now we had all the elements of a deal. Went back to George and we said, George, would you like to introduce the lieutenant governor at breakfast and have the chamber president introduce the mayor at lunch, and we'll put together a program for you? And he went, well, sure, that works for me. And so looking to each of their needs for power and the want to be in front of each other, we got them all onto the same floor. Okay? And then Barbara and I wrote the entire script of the conference. And it was bringing together all the authorities that could speak to exactly those points of what was happening in health insurance, how it was going through into the private sector, why they didn't want that to happen, why health insurance for the uninsured was a better deal. And that went on for half a day. And it was wonderful because nobody could leave because the lieutenant governor was there and the mayor was there and they all had to be in front of him. So that worked out pretty well. We got it done. We wrote it up as a white paper. We circulated it to the chamber. They adopted it. It went to the other 7 chambers, the largest 7 chambers of the state. And when it came time for the legislative session, the Children's Defense Fund comes in one door with their true stories of these kids that are greatly in need. And here comes to the other door comes George DeMontron and the 8 chambers of commerce saying, we think this is good for business. And they passed it through the House and they passed it through the Senate and the governor signed it. Your partners may not always exactly share your methodology. They may not exactly be wanting things to happen for the same reason. But if they end up supporting them, I will take them because that's what it took in those circumstances.